Thank you for joining this Medicare Overview. Today we'll be discussing Medicare basics from A to D, what Medicare is, who's eligible, what your coverage options are, and when you can enroll. Hopefully, at the end of this discussion, you'll have all the information you need to take your next step toward better health. So let's get started with the basics. What is Medicare? Simply put, Medicare is a federal health insurance program for both eligible citizens and legal residents, and is funded in part by the taxes we pay while employed. Since its inception, Medicare has undergone a few changes and additions, most notably the parts: Part A, Part B, Part C, and Part D. We'll talk more about these later, but for now, just know that these additions were created to offer more benefits and elective coverage options. But what about the who, as in who is eligible? Any United States citizen age 65 or older is eligible for Medicare, as are legal residents of the same age who have lived in the U.S. for at least 5 consecutive years. Citizens and legal residents younger than 65 are also eligible with a qualifying disability, or any person of any age with a diagnosis of end-stage renal disease or ALS, Lou Gehrig's disease. Chances are you meet the criteria for Medicare coverage. So what are your coverage options? As we touched on earlier, Medicare is made up of parts, which lets you more or less choose the coverage and benefits you need while passing on the ones you don't. Parts A and B are often lumped together and referred to as Original Medicare. You can have one without the other, as you enroll in both separately, but it's not advisable to do so. It's best to plan on enrolling in both Parts A and B to cover a wider range of health costs. Part A helps pay for hospital stays and inpatient hospital care. It also covers inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Part B covers doctor and outpatient visits such as physician services, outpatient hospital services, ambulance transportation, outpatient mental health, laboratory services, durable medical equipment such as wheelchairs and oxygen, outpatient physicals, occupational and speech-language therapy, and some preventative care. Original Medicare covers many essential services, but it doesn't cover everything. Both Medicare Parts A and B have deductibles and coinsurance. While Part B requires a monthly premium, most people do not pay a Part A premium. Additionally, Original Medicare does not cover prescription drugs or offer additional benefits like hearing, vision, or dental. Long-term care or custodial care, such as most nursing homes, are also not covered by Part A or Part B. Most people agree that they need additional coverage beyond what Parts A and B offer. There are a few ways to get it. The first option is to enroll in a Medicare supplement or Medsup insurance plan. Medsup plans are offered by Medicare-approved private companies. These plans are sometimes called Medigap plans because they help fill so-called gaps in Original Medicare. If you'll recall, Original Medicare doesn't cover everything. Actually, it only pays 80% of your out-of-pocket costs. Medsup plans are designed to help with the other 20%, such as co-payments, co-insurance, and deductibles. To be eligible to enroll in a Medsup plan, you must also be enrolled in Medicare Parts A and B and must reside in the state in which you are applying for coverage. As for age requirements, the general rule is that you must be 65 years old, though some exceptions are made for individuals with certain disabilities. Part D is an optional benefit that adds drug coverage to Original Medicare. However, there will be a penalty if you choose not to enroll in a Part D plan. Because Part D is also offered by private companies, the cost and extent of coverage will vary from plan to plan. It's therefore important to research different Part D plans to find the ones that cover the medications you need. And be aware, each plan's covered prescription drugs can change, and the dollar amount covered can fluctuate if you hit predetermined limits. To be eligible for Part D, you must continue to pay your Part B premiums. The third option is Part C, also known as Medicare Advantage. These plans are offered by private companies and can vary in the benefits they offer and therefore cost as well. But usually Medicare Advantage plans bundle Medicare Parts A and B, the hospital and medical coverage, into a single plan. One appealing feature of these plans is that many of them have $0 monthly premiums. Depending on the plan details, they may also offer additional benefits not covered by original Medicare, such as routine vision care, hearing, and/or dental. To be eligible for a Medicare Advantage plan, you must be enrolled in Medicare Parts A and B and live in the county in which the plan service is provided. A Medicare Advantage plan, MA, with prescription drug, PD, coverage is also known as MAPD. MAPD plans give you everything a Medicare Part C plan provides, with the added advantage of prescription drug coverage. Like standalone Part C plans, many MAPD plans have a $0 monthly plan premium. Additionally, many of them provide extra benefits like transportation to doctor appointments, over-the-counter medications and supplies, and even health club memberships. As previously mentioned, these plans are offered by private companies. To be eligible for an MAPD plan, you must have Medicare Parts A and B and live in the service area where you receive coverage. Now that you have a basic understanding of Medicare's parts, as well as additional coverage options, it's time to talk about when you can enroll. While the government has different enrollment periods set up for beneficiaries, the annual enrollment period, also known as AEP, is from October 15th through December 7th of each year. It's an opportunity for people to enroll for the first time or switch plans and benefits from a previous year. Plans selected and enrolled in during this period go into effect on January 1st of the following year. This is the rule, but there are exceptions. For example, when you first become eligible for Medicare, you are entitled to an Initial Enrollment Period, or IEP, which is a 7-month window that starts 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after. Plans selected during IEP generally go into effect the first of the month following enrollment, or the first of the birthday month. There are also Special Enrollment Periods, or SEPs. SEPs allow you to enroll or switch plans due to special circumstances, and the effective date is generally the first of the month following enrollment. And that brings us to the end of our overview. We know you'll have questions, so please feel free to reach out anytime. We can answer all your questions in much more detail and provide solutions that are tailored specifically to your healthcare needs. But for now, thank you for joining us today. Hopefully, we've made Medicare seem a little less overwhelming. As a parting word, a few next steps we suggest would be to review your enrollment periods, research your options, ask questions, get answers, find financial help if eligible, enroll in a program, and each year conduct a yearly review. When the time comes to make a decision for your Medicare plan, it is essential to speak with a licensed agent for guidance. We want to make sure we provide you with all the options and help you pick a plan that is best suited for you. Thank you for your participation.